today we're going to be covering a specific topic, atherosclerosis, and kind of some specifics on what to do and how to make sure you prevent it, as well as some possible things that can help reverse some issues and some of the complications that are associated along with it. Atherosclerosis and something like how do fish oils help prevent this? All right, so some of the topics and questions that we're going to be looking at today is what is atherosclerosis? What is the mechanism of the pathology? What other complications are caused by it? How can a simple supplement such as fish oils prevent it and even reverse it? And what is the biomechanical and biochemical impact of fish oils? So let's first kind of cover what is it. So it is a disease caused by the deposition of plaques of fatty material on the inner walls of arteries. So kind of just some of the basic components of an artery. So we have here kind of a diagram showing you that we have the tunica externa, which is the outermost layer. We have the tunica media, which is the middle layer between the outer and the inner. And then we have the tunica intima, as well as the basement membrane, which sits on the inside of the tunica intima. Now it's important to note that the layer that is affected is the tunica intima. Now let's take a look at how arterial plaques are made. So before we dive into that, we want to have some basic understanding of some of the immune cells within the body. So we have macrophages, which are the innate immune cells present in every tissue. These cells are necessary for homeostasis. They sense and respond to pathogens and other environmental challenges. They also participate in tissue repair after injury. Now there's a couple different types. So we have two types. The M1 type macrophage, which are also known as classically activated macrophages. They are activated by pathogen invasion, and pathogen is just a fancy word or medical term for anything that causes a disease. So this could be bacterial, viral, or fungal. These play a large role in immune response to foreign pathogens such as bacteria or anything else. Now, M2 type macrophages are also known as alternatively activated macrophages. These play a role in wound healing, tissue repair, and have anti-inflammatory roles. Now let's kind of dive into it a little bit more. So here we kind of have a little cool schematic, keep you guys entertained and kind of keep you guys following along, because I know when I first learned this material it was very overwhelming, hard to stay awake through it, so kind of just give you some funny images to kind of help you follow along. So their specific function of M1 type macrophages is they play a large role in destroying infectious organisms that enter the body, clearing debris and wound healing. So pretty much they detect, engulf, and destroy. So you can kind of think of it as a heat-seeking missile. And George, if you want, you can throw in a little quick snippet of just like a heat-seeking missile blowing something up. It'd be kind of cool. They do this through phagocytosis, which is the ingestion of bacteria or pathogens. M1 type macrophages also form granulomas. These are aggregations of macrophages that function in walling off an infection. They also promote inflammation. Now, inflammation is often termed a bad thing, but it is our body's response and mechanism of healing and allowing us to have a response. So through the breakdown of proteins and digestion of antigens, it signals the body to have an immune response, which is what we know as inflammation. Now, on the other hand, we have M2 type macrophages. Now, their specific function is regeneration of connective tissue during wound healing. They produce vascular endothelial growth factor, or VEGF, which allows for vascular stability and wound repair. So you can kind of think of this as the cleanup crew. That's why I use the Mr. Clean there. So they phagocytize bacteria and damage tissue around the wound. They debride damaged tissue by releasing digestive enzymes such as proteases. Now, proteases is just a word for enzymes that break down proteins. They also secrete growth factors and lay down new extracellular matrix. So how is the plaque going to cause an issue that causes atherosclerotic effects? So pretty much it's just consumption of bad fats. We have good fats and then we have bad fats. We'll kind of go into that more later. Atherosclerosis develops slowly as cholesterol, fat, blood cells, and other substances in your blood forms plaques. The buildup of plaques causes arteries to narrow, and this in turn reduces the amount of oxygenated blood flow to vital organs. Now, we have this specific thing that kind of happens with macrophages, and we term them foam cells. So these cells are formed through dysregulated lipid metabolism in mammalian macrophages. The macrophages attempt to break down plaques but are slowed down and, in a sense, corrupted by LDL, which are low-density lipoproteins, causing them to become laden with lipids, resulting in the formation of foam cells. Now, these foam cells build up in the area that they're cleaning, which eventually results in primary atherosclerotic lesions. So here we kind of have a schematic, and you kind of see my cursor. So we have the macrophages, which are now in the area that they're supposed to be. And then ROS is reactive oxygen species. This interacts with LDLs to form oxidized LDLs. The macrophages then consume the oxidized LDLs. You can kind of see the lipid uptake. which form the foam cell, and then it causes this aggregation, thus closing the arterial wall. So here we have the blood, here we have kind of the layers that we were taking a look at earlier, and this eventually forms these fibrous plaques that we can kind of see up here. So here I'm kind of just showing you the schematic of some of the complications of atherosclerosis. So here I'm kind of just showing you the complications of atherosclerosis, some which may be heart attack, stroke, vascular dementia, kidney issues, aneurysm, peripheral vascular disease, hemorrhage, and even an embolism. And you can kind of take a look at some of the modifiable risks that are there, some of the non-modifiable risks, and then some of the development and progression of the complications that can occur with atherosclerosis. So kind of coming to the main topic here is how can fish oils help? So firstly, we know that low density lipoproteins are the main culprit and the root cause of this issue and the formation of these things called foam cells. So if we can lower low density lipoproteins, which are the bad fats, and increase the better ones, then we have a better chance of stopping it before it happens. So fish oils are extremely high in what we know as omega-3 fatty acids. These help lower the bad LDLs, as we said before, and increase the healthy high-density lipoproteins, or HDLs for short. Now, fish oils tend to inhibit the infiltration of macrophages, preventing the formation of foam cells in the first place. This helps remodel and stabilize vulnerable plaques that may cause complications. Now, an important thing that the literature has shown is that it is the plaque vulnerability, not the degree of luminal stenosis, that is the major determinant of the risk factor of atherothrombotic events. This means that by allowing there to be stability through the consumption of fish oils, we can prevent the complications that are associated with this pathology. So let's take a look at the omega-3 fatty acids mechanism of action. They help lower triglycerides, which helps reduce the overall hepatic secretion of triglyceride-rich lipoproteins. They also decrease severe clotting, so a high intake of omega-3s produces more of the beneficial molecules that have a positive vasodilatory and anti-aggregatory actions within arterial structures. Pretty much just helps keep you vasodilated, not constricting the blood pressures, and helps it not kind of back up the fluid mechanics throughout the entire arterial system. They also help prevent inflammation and allow for homeostasis. Now, the metabolism of DHA and EPA acids, which are normally found in fish oils, helps yield a specific class of lipid mediators which promote the resolution of inflammation. This process helps return the arterial structures to homeostasis, which prevents acute inflammation from becoming chronic inflammation. This is an important thing just because it allows for us to maintain our normal mechanism of action that our body's used to. When we are in a state of inflammation, our bodies tend to freak out a little bit more, we have a lot more issues, and we know that chronic inflammation can be a bad thing. Acute inflammation is good. So how often should you supplement with fish oils? Every day. You want to consume around 1,000 to 1,200 milligrams of fish oils, usually in the dose of 1 to 2 fish oil pills, so it's not a lot. It just depends on the size of them. And make sure that the label has the amount of EPA to DHA ratio, or the golden ratio is what most people will refer to as a 3 to 2 ratio of EPA to DHA. Here's some of the sources of where I found everything, so you guys can take a look at the articles, the journal articles regarding either how omega fatty acids stabilize and remodel some of their arterial structures, or some of the mechanisms of action of macrophages and their specific actions and roles they play in the body. So that's really all I had for you today. Kind of just a brief overview of what it is, some of the things it can cause. So we tend to hear this a lot in the prognosis of things and some of the issues that are caused by atherosclerosis. And a lot of times it's not covered in what is it actually is, what is the root cause of it, how we have what people call good and bad cholesterols or good and bad fats, and what really is the issue that causes most of these things to happen. If you did find this video helpful and informative, please like, comment, share, and subscribe, as it is the best way to support our channels. Thank you so much and have a wonderful day.